Welcome to the University of New Mexico Health Science Center, where every day our research is bringing new therapies and new ways of practicing medicine to life. We're New Mexico's only academic health center. We're responsible for bringing our research into practice to make people's lives better. At any given time, we have over 900 major research projects and over 300 clinical trials. One of the things I'm most proud about is that every day our faculty are doing research to address the most pressing health needs in New Mexico. From the opioid misuse epidemic to psychiatric disorders, to building new devices to better diagnose disease, to finding new drugs to better treat diseases. We have been very fortunate to be one of 60 institutions in the country that have been given the Clinical and Translational Science Award.
First of all, we learn from community and other colleagues as what is needed in the community. That is how we try to come up with clinical trials, and then we need to implement that. UNM Pediatric Clinical Trial Center is very successful because we have been able to leverage resources as CTSC. Having a state-of-the-art infrastructure and clinics available to our patients have made a huge difference in our capability to conduct these clinical trials in a timely manner.
I believe we have very unique environment here. First of all, it's access to very unique study population. All of my projects are multidisciplinary. We easily collaborate with 15, 20 other scientists throughout HSC and main campus. Otherwise, we won't be able to carry these projects. Building those teams is crucial for us.
I study broadly substance use and misuse in our communities. So my role in addressing the opioid epidemic in the state really is to bring together all the stakeholders that are engaged in solving this problem and coordinate and integrate the intervention efforts. I worked with the Office of the Medical Investigator and our Chief Medical Investigator to get the data from all of these individuals who had suffered an opioid-related overdose death throughout the state, and then use that to target our most affected communities so we could see exactly where these clusters of deaths were happening. And so the goal then is to go into these communities and intervene at the same time in all of these different levels of healthcare, community and school prevention, and criminal justice.
We're interested in trying to find big public health problems and then trying to make an impact by developing vaccines that target those things. We have basically a vaccine platform system where we can take what we call virus-like particles, so sort of empty shells of viruses. And one of the things that makes these really good is they can induce really strong immune responses. And so that's exactly what we're trying to do with opioids. So we're taking these harmless virus-like particles, we're displaying the drugs on the surface of them, and then we're using that as a vaccine. And essentially we can fool the immune system into making immune responses against something they normally don't respond to. But the idea then is that if the individual relapses and uses drugs, they won't get a high from the drugs because of the antibody responses, and that could prevent them from descending into that spiral of drug abuse.
The mission of the UNM Health Science Center is to make more progress in improving the health and health equity of our communities than any other state. I often say that we have the largest campus in the United States because the whole state is our campus. We might be small, but we punch way above our weight.